Hi guys, my name is Alison Viktorin and this is...
I'm Dr. Gregory Simonsen and we're with the Texas Psychological Association.
Go TPA!
And this is our second video, and today we are lucky enough to talk to the president of TPA, Dr. Rob Mehl, and he is going to talk to us about the legislative agenda that's been going on this last 6 months and what TPA has been doing.
Alright, so our first question, drum roll. What was the overall goal for this legislative session?
Our main goal is to protect the doctoral level of the psychology profession. We've always been a doctoral level profession and we want to keep it that way, and the public has a right to know the extensive training that it takes to become a licensed psychologist. Another goal we've had is to expand our ability to do some practice. There are many master's level practitioners and some of them are trying to become psychologists in name only without the same kind of training that we have, and we think the public needs to know when you go to a psychologist, that's a doctorate level training. We had two main bills.
So the first bill responds to a master's level person trying to get the title of a psychologist without having a PhD. That's correct?
That's correct.
Okay.
And another reason that's important is because the master's level people aren't paid as much by the insurance, and it puts a downward pressure on the services we provide in terms of what's paid for that.
So I think that second bill you're talking about was kind of commonly called the extender bill, is that correct?
That's correct.
And that seems really particularly important to me because I remember when I was just getting out of school and had just gotten my license, it was very difficult to find a job because I couldn't bill insurance, I couldn't get on insurance panels for up to 3 years, and it really limited my ability to make a living after I had spent so much time and energy in school and getting licensed and things like that. That
bill would have made a tremendous difference for brand new psychologists.
So were there any bills that we opposed in particular?
Yes, the licensed specialists in school psychology who work in the schools proposed a bill in the legislature to use a credential that would have made them look like licensed psychologists. And we opposed that bill for that reason. There are school psychologists now, but those are the ones that already have a PhD and are licensed. So they do work in the schools, they have their PhD, and so it's clear, once again, that the doctoral standard for psychology is preserved.
That's good.
Then that's vital, I think, to the public's ability to make informed decisions about their care.
The public needs to know what to expect.
I would be the public. I deserve to know! So what can we count as a success for this legislative session?
Well, the biggest success we had was with the LSSP bill. We had to work very hard, and we had a tremendous grassroots effort. People calling in, sending emails, writing letters.
That's you guys calling in.
That's right. And that made the difference. That killed the bill. It did not come up on the Senate floor really because of that intense lobbying effort. So we also, on the bill to put the supervision into statute, got all the way through the House, through two committees, and passed the House with not a single vote in opposition.
Wow.
But it just didn't make it in the Senate.
So we've put that bill forth before, correct?
That's correct.
So each time we get a little closer, that's better for us, perhaps for next time. What's the best thing that a psychologist can do between now and the next legislative session to help us out during these times so that we're able to protect psychology?
Well, the Grassroots Network was very effective.
Tell us what the Grassroots Network is.
Well, the Grassroots Network has a psychologist identified for every legislator. And we call on those psychologists when it's time to contact your legislator. And that worked great in terms of the call-in. The other thing that the Grassroots Network is for, and where we really need to work, is the personal relationships. It was the personal relationships that psychologists did establish with their legislators that made the difference in the House.
And how do you make a personal relationship?
You call them and invite them to lunch.
Everyone likes lunch.
And you talk to them. So it's the stuff we know the best is relationships.
Are there any groups of people or any person that you'd like to thank for their work over this last 6 months?
Many people. Many people. Representative Jody Laubenberg sponsored our bill. Representative Elliot Neistat, the chair of the committee, Representative Lois Kolkhorst, was very supportive. On the Senate side, we had Senator Duell, Robert Duell, who's also a physician, was very supportive of our bills. Well, I do want to say, I've got to thank all the psychologists who talked to their representatives and senators.
Yeah.
That made a huge difference.
Yeah, and I know some people really took the time out to go up and go to these hearings and testify before the committees.
Absolutely.
And were there till all hours of the night,
Wow.
flew in, stayed up all night, flew back home to their practices. So, and the work has to start now.
Yeah, that's true. Because now is the time to make the personal relationships work.
Absolutely.
All right, well, thank you guys for watching, and until next time, I'm Alison Viktorin.
I'm Dr. Gregory Simonsen.
Thank
Dr.
you.
Rob Mehl.
Yay!
Thank you.
All right, bye.
Bye-bye.